So there are no simple facelifts. Facelifts are surgical procedures that involve risks, but there are facelifts that are complex. And it's really important to understand that for those complicated facelifts, you need a super expert surgeon that really understands the anatomy, the facial anatomy, the deeper neck anatomy. So what are the complex facelifts? What are the facelifts that are really, really more involved than less complex facelifts? So I kind of think about it the following. If you're going in for a second facelift where the tissue planes have been previously operated on, you're having a more complicated surgery. It still can be done very safely, but it needs to be done with an expert. If you've had extensive amount of fillers, biostimulators, previous microneedling, radiofrequency, injections into your face, thread lifts, the surgery is going to be a little bit more complicated. The tissue planes may be scarred, the anatomy and facial anatomy may be complicated. If you've had a prior history of Bell's palsy or facial nerve injury from a previous facelift, that's a higher level of complexity, and it really, really requires an expert. If you are going in with very, very deep, heavy neck anatomy, where the submandibular gland, the buccal fat, the deeper fat compartments need to be addressed, those are complicated procedures. They're very close to the nerves. You need to be very, very involved, and your surgeon needs to have a higher level of expertise. So these are just the few types of facelifts that really have a higher level of complexity, requiring a very, very expert knowledge in facial nerve anatomy, in muscle anatomy, and tissue anatomy. So make sure you are seeing the correct surgeon that understands these issues.